to grab a seat. We're just going to get started. We've got some people with us online as well, so we can give them a wave. Are we microphone? Yes, we are.
Brilliant. Can everyone hear me at home, in the room?
Yes.
Brilliant. Thumbs up. Thank you. Well, thank you so much for joining us today. You guys online, you guys in the room. We're absolutely delighted to be able to be sharing with you the outcomes and learnings from a programme that we've been running this year at Asthma Lung UK, which has been our Innovation Accelerator. So I'll just start with the why. I appreciate everybody in the room and online. I'm not going to dwell too much on the why for respiratory, because we all work in the respiratory sector. As you know, 1 in 5 people will experience a lung condition at some point in their lifetime, and for most of these people, that lung condition persists for years, or in fact, generally decades. Again, the vast majority of these people are treated in primary care, which means, according to the guidelines, they should be getting a GP visit once a year, if they're getting that. But that means that they're self-managing for the other 364 days of the year. And that self-management's really hard. People have got to have capabilities, opportunity, motivation. But at the same time, we know that good self-management is essential. It really improves people's quality of life. It also slows the decline of progressive lung conditions, which is brilliant on an individual level. But at the same time, it's also keeping people out of hospital. It's reducing winter admissions, and it's potential cost saving for the health service. So, perhaps unsurprisingly, one of our strategies at Asthma Lung UK is that we want to see self-management tools for people with lung conditions in the hands of more than 2 million people. And really good progress towards that. Hundreds of apps and devices and products have already been developed that encourage and support self-management for lung conditions. And yet, unfortunately, we don't see any of these used at scale or widely adopted yet. And so this is kind of the context of this piece of work and where we've set our challenge. So we wanted to really give the respiratory sector, respiratory innovation, a boost. And we thought we need to do something that's not already been done, because clearly what's been done already is not yet working. So this was specifically not research grant funding. We thought, we could, in fact, in the past, we have run grant rounds in respiratory innovation, and we've, I think helped progress some really brilliant products, but they've still not got to the market, and we had to look at what's going wrong. And one of the reasons that we think they're not getting there is that the traditional research grant funding is very focused around clinical efficacy, around cost effectiveness. You start with small audiences, and they're very much, your typical clinical trial audience. They're probably a bit more motivated. And we thought, we really need to test these products that people are going to use day in, day out, probably without any support from other healthcare professionals, or not necessarily with support from other healthcare professionals, with the real world audience in a real world setting. And so that's what we wanted to develop with this accelerator. And so finally, because there's lots of products out there, we thought we'd try and focus in on a theme to help us, focus the learnings. We picked moving more for a variety of reasons. One, we know that anybody with any lung condition, and also any severity of lung condition, will benefit from being more active. This is not necessarily about exercise. People could be very inactive, but they can still raise their levels of activity. There's a huge amount of insight kind of backing up this, both kind of externally in the literature, but also internally from Asthma Lung UK. We've done work in the past, and we've got a good understanding of the different challenges and barriers that people experience who are wanting to move more. So we very, very much kind of had a good understanding in this space, and that's why we picked this and we wanted to invite products that met that brief to enter our Innovation Accelerator. We also knew that kind of within our team at Asthma Lung UK, we didn't necessarily have the expertise in-house for what is essentially user testing, usability testing. So we chose a partner, and I'm delighted to introduce Jenny from Humanly, who's going to take you through a bit more of the process that we went through and the methodology that we've created. Over to you, Jenny.
Great. Thanks, Erica. Hi, for those of us who are online. Okay, I need to be this far forward for you to see me. So yeah, in terms of the team behind this project, we didn't set out to deliver this programme on our own. we were brought in for our experience of co-designing high quality products and services that meet user needs. However, we also brought in 5 people living with lung conditions to work alongside ourselves and the team at Asthma Lung UK over about 11, 12 months to actually make sure we were keeping what matters most to people with lung conditions at the heart of the whole programme. So over 12 months, we have worked together to launch the open call for innovations that help people to move more. We shortlisted 6 innovations from the 10 who expressed interest. We whittled that down to 2 through many discussions and work as a team. And then we designed a testing process for those 2 products, which we will tell you a little bit more about. We co-designed a set of criteria for how we would actually assess those products. We tested them with a wider cohort of people living with lung conditions, co-analysed the results and delivered insights and practical recommendations to the teams behind the products. So in terms of who we tested these products with, we focused on diversity, and we targeted our recruitment at those who are most at risk of poor respiratory outcomes, and also groups who are traditionally underrepresented in respiratory research. So that was really key to this stage of the process. We worked with those people over 8 weeks. It was very in-depth. At the core of the process was a mobile ethnography study, where we had people use the products over 8 weeks and capture all their experience, feelings, thoughts in real time on a daily basis, sending us videos, screen recordings, photos, so we could directly observe how people actually used and reacted to these products in the moment, but also over time, as well as getting an insight into what their life was like more broadly. We coupled that with in-depth interviews with people at the beginning and end to go deeper into their expectations, motivations at the outset, and then clarify and capture those reflections at the end. And this was also coupled with usage data. So we had access to the actual usage data from the product teams, and we could compare that to what people self-reported, which was really helpful and also helped us to identify trends. When we were designing the mobile ethnography study, we actually mapped out the products screen by screen. So we went really in depth into the current user journey to really understand what would be worth digging into in more detail over those 8 weeks. And this is a snapshot of what that looked like. So the first product we took into testing is BreathTec. Shortly. Essentially, BreathTec is an online programme that people work through. It's a course made up of different modules around breathlessness, staying active and mental health. So we designed the tasks to take people through that user journey, capturing their first impressions, how they experience those different phases of the programme, and at the end, reflections on their journey and what their perfect version of the product might look like. The second product that we tested is Breathment. Breathment is an app that supports people through a set of tailored exercises that they do in their own home. Those exercises are set by a physiotherapist who they speak to at the beginning of the programme. Then they work through those in their own time. And the great thing about Breathment is the exercises are supported by AI analysis. So AI is able to recognise the user's movements and monitor their technique. So you get real-time feedback on how you can improve your technique, and the physio can access that data at the back end as well. So for Breathment, again, we designed the tasks to take people through the journey of getting started, their first session, using the app over time, and then exploring other features as well, such as educational courses, attending group sessions, and all the way through, we asked people to capture daily updates as well of how they were getting on, any challenges, frustrations, high points, and impact they were seeing over time. So this resulted in over 1,300 uploads to the mobile ethnography platform. 900 of those were videos and screen recordings of people actually using the products, so we could actually watch them and hear them talking through their experience. And that equated to over 58 hours of footage. And all of that data was analysed manually by the team. So we went through everything painstakingly, and I think it generated really rich and nuanced insights. And I'll let Erica tell you a bit more about what the outputs and impact of that was.
Lovely. Thanks, Jenny. So on this screen, we've just got a snapshot of some of the reporting pages that we've given to the product owners. But I think from our perspective, it answered a lot of questions that we'd have about any product that kind of came to us. So firstly, we could see very clearly who was using it and who wasn't, what types of people, what kind of backgrounds or kind of behavioural traits they may or may have. So it gives us an understanding of, we appreciate that not everybody with a lung condition is going to use any single product. And we think it's really helpful to be able to understand what types of people might want it, because it could really help, if these get rolled out in the future, for prescribers to think, okay, well, this product might suit you. So we can get a good understanding of what types of people like which types of products. We had a really good understanding of why they were using it. All of this footage gave us, really rich data as to what bits they liked, which bits they trusted. And so you could also then start to look at components within the products you can start to think, well, if people like this, let's try and lean into that a bit more, or other bits of actually, people aren't really liking that, let's dial that down a bit. So it could really help kind of iterate the product into something that is more desirable. At the same time, we saw actual usage, and we kind of really interestingly for us, we observed one user, they were telling us one thing in their videos and their usage was saying something completely different, which we know we observe in a healthcare setting. We were quite surprised to observe it in this test setting, because we told people that you don't have to use it, you just need to tell us what you're thinking. So it was quite surprising to see that, but I think it shows the strength of this methodology. We can still kind of triangulate between usage and what the user is telling us. This methodology allowed us to see where the drop-off happens in each of these products. So, what percentage of people get past the sign-up phase? At which stages are they falling off? Is there a stage where lots of people are just giving up on the product? Because again, it can signpost us to where you need possibly better development in terms of the product. The 8-week process, we had a lot of conversations around, is this too long? It's an in-depth, resource-intensive process. However, what we observed, particularly because this is self-management, and when we think of self-management for lung conditions, you need to adopt a behaviour for quite a number of weeks before you might see the benefits of it. And what was really interesting, and what we observed in the observation, was that we could start to see people benefiting it from the product or within their quality of life before they notice that themselves, which again is perhaps something that we can then feed back into the products and help draw people's attention to the benefit they're getting, because they certainly didn't observe it until much later. But it did allow us to map these user journeys and how people were feeling at different stages of using the app. And finally, as we touched on a couple of times, we've just got really, really rich evidence, hours and hours of footage, quotes, every single recommendation that we can make for products that have been through this process is backed up by videos. You can see someone literally trying to do this on a screen recording or telling you about it. So we're just, absolutely delighted with what this methodology could give us. And so to kind of summarise from Asthma Lung UK's perspective, we think this is a brilliant process. We want to see better processes to help people to create products that are both clinically effective, but also marry that with usability and desirability. There's no use of product being clinically effective if nobody wants to use it, and that's really essential when it comes to self-management products, that we are working with the end users to understand that, to have those better insights, and also from a real world population, not necessarily the self-selecting population who might enter clinical trials. If we can get these better products, it will be more effective for a more diverse population, and that's how we really want to drive better outcomes for everybody with lung conditions. So just before I hand over to the product teams, who you can hear from in a little bit, we are, to finish off this process, there's going to be an independent evaluation of this programme, again, to help us identify what's worked really well, what we might be able to improve in the future. We really want to see this methodology used more widely. We think the addition of usability data hand in hand with your clinical efficacy and your cost effectiveness could be the thing that unlocks commissioners, regulators, helps us get products to the next level. To that end, we're trying to promote this through events like today. One of our co-designers, Joubert, is also creating a short film to document how the project has gone. We've been presenting at a couple of conferences. We were up in Edinburgh a couple of weeks ago, and we'd also really like to publish this methodology in an academic paper as well. So hopefully we can share this methodology more widely. And if you'd like to find out more, I'm going to leave this QR code on the screen for a little minute. Jenny and Ali have been blogging about the process, so you can read in more detail all the different stages we've been through over the last year. And so I'm now delighted to hand over to Karen on behalf of BreathTec, who's going to tell us about her experience of going through the process. Thank you.
So I'm delighted to be here, obviously. And just really for those who don't know much about it, you have to go forward a bit. This is the process that we went through. So at short notice, someone emailed me to say, have you seen the advert out by Asthma Lung UK about digital innovations? And I said, no. So I had a look and thought, I will try and applied for it. So it was very short notice. And then it was for the expression of interest. And was lucky enough to get an interview. So I joined online, and I think I wasn't well on that day as well, but as there seems to be a theme here. And there was a big panel. I was a bit shocked. There was about 15 people there. There seemed to be a lot of people interviewing you, but they were all very nice. And it was really nice to see patients, people with lung conditions there as well, asking questions and about BreathTec and how what all about it. Then you had to sort of reapply. So we filled in the application form, and were lucky enough to be successful. So we met about how it was going to be testing patients, and to be honest, we didn't really understand how that was going to work. We thought maybe they'll test it and do some qualitative interviews, and that's how it usually works. So I didn't realise how in-depth it was going to be. Not that it would have put us off, because it's even better than what we thought. So it was fantastic to see how you picked the group of people to test it, and all the different ways that you were going to evaluate it. And then we came up a few weeks ago, where the feedback was just phenomenal. I mean, we've worked on this project for years. We both, Dr. Burns and I, both worked in respiratory for a long time. I've been there 37 years. And we built BreathTec with patients. So we had a lot of feedback over the years about BreathTec. But they maybe been a bit biased, that they know us and didn't want to upset us, and perhaps weren't as honest as they could have been. And we've put a lot of research into this, so it was fantastic to get feedback, good and constructive feedback of things we could change. It was just astounding. And I've never seen the ethnography video technique being used before. And I do one day a week at Newcastle University, and they were blown away at this rationale and methodology, and definitely want a paper. But I've been asked to do a paper, so if you want to do a paper, we can collaborate and get it. It's an open access journal, so we can perhaps have a chat about that. So we've got the feedback, and here we are at the celebration event. So for generally talking about our experience, well, the team at Asthma Lung UK have been fantastic, but I would say that, wouldn't I? And humanly have been brilliantly, everybody there. So, we have been supported along the way, and, they've been a fantastic team. The research method, as I've said, was just very in-depth, and I think it's a method that other people should use. I think qualitative interviews, whilst they're really good to find out people's experience and learn more about the topic, I think actually having that real-time videos, feedback to correlate, is that the same as what they're doing, has just been fantastic. So we really appreciated all the feedback and are going to take that on board. So what we're going to do next is, well, you asked sort of about the process. Well, this is what you said you were going to do, and I definitely think you've done it. You have access a diverse group of people that we may not have had feedback from. You've given us definitely bespoke insights into BreathTec and what we could do. But not only have you given us the feedback, you've given us answers to address that thing, ideas, which is a great help. We've got tailored recommendations from Humanly and guidance on how to move it forward. So that's been much appreciated. So what we've done so far, so we've got a business analyst who has gone through the report, which was 145 pages, if I'm not correct, if I'm not mistaken. So we've gone through this and we've put the feedback and we've put your recommendations down. We haven't quite worked through the requirements yet, but what we're hoping to do is go through what we think the digital company who built BreathTec need to do. So what we need all the recommendations. We're going to go to Enigma, which is the company that did it, and ask for costings to see how much is this going to cost to do, because we really, there probably wasn't one thing that we didn't agree with, apart from BreathTec. We spent an arm and a leg on the name. We patented it. We can't change that bit. But what we can do is explain to people why it's called BreathTec, and I think that's probably what we will do for that bit. Well, then once we've identified what we need to do and made the changes, we'll need to update. This was our original patient pathway. You won't be able to see it, but it just went through what we thought was the IKEA journey, which wasn't sometimes the IKEA journey that we thought of. So we will update the patient pathway. And we are hoping, we are working on further research and development. And it'll be an ongoing process. This is never going to be the end. We've, a digital program, you've just got to keep on top of it. So we need funding. We're funding it ourselves. And so we've got some funding resources that we've decided that we'll hopefully go for. Asthma in UK will hopefully support us applying for those grants. I'm going to apply to the Association of Respiratory Nurses for some funding. It'll be a small amount, but anything is a help. And then who knows, there may be other funders that we haven't identified that might be able to help us. And obviously we will be working with our partners Enigma who helped us build the programme and who were really good. And that's it, I think. Thank you.
Thanks, Karen. We're now going to hear from the team at Breathment.
Hey, hello everyone. My name is Alcin. I'm the co-founder and CEO of Breathment. So as Dave mentioned earlier, we also had the perfect time and opportunity to participate in this program and work together with Humanly and Asthma Lung UK throughout the last couple of months. So a little bit of recap before we move forward. At Breathment, we have a digital health platform focusing on respiratory conditions. And before starting this program, we had a ready and at the same time an unready product and solution. So at least something that we could start with, but throughout the process, we learned a lot that it was unready. So we offer a therapy app to the patients, which is like a companion app for the patients throughout their entire life, where they can learn about how they can manage their situation in their daily lives and they can also keep track of their treatment progress. We offer an AI-powered trainer, which gives them access to a 24/7 available personal trainer, which would guide them on their exercises using the power of AI. And lastly, we also offer a remote patient monitoring software for the health professionals, through which we ensure that the health professionals are in control of the digitization of the entire treatment. So this was the solution that we have built and a ready product. So one of the most important things that we would offer with this solution was online therapy sessions in one-on-one settings with our health professionals. We think this is also something very, very important for the patients suffering from these conditions, so that they can get access. They don't need to commute significantly. And at the same time, offering online group therapy sessions, which ensures that building this community where they don't feel themselves alone facing with this disease, but they could also learn from their own peers. So this was pretty much of a setting that we had. And again, we were very happy to have had the opportunity to work together with Humani and Asthma Lung UK throughout this Innovation Accelerator. So a bit of how we started and why we thought this was very important for us at Breathment. So we are a team of 3 young entrepreneurs who have engineering backgrounds, and we decided that we would like to bring our skills and abilities into developing a solution for people facing with lung conditions, helping them out through their daily lives, and then bringing them or providing them a better world where they can keep or where they can take care of themselves as well in their daily lives. However, when we first started, we weren't really very good in terms of understanding the patients themselves and their needs, because again, we are like 3 young entrepreneurs coming from engineering and tech backgrounds, and the initial indication that we are offering, COPD, we were facing in general elderly people who would have limited digital literacy, so they were not very good, most of them using digital solutions. At the same time, a majority of these patients were also not very adherent to the treatment offered by the health professionals, or in the same time, they were not able to access this treatment based on where they're located. And they were also a little bit hesitant to adapt some kind of technical solutions. And in their daily lives, they were facing a lot of health fluctuations. So these made it a little bit difficult for us to provide a solution specifically focusing on the individual needs of these patients. This is why this accelerator program was very, very beneficial for us to get direct insights from the patients. And so that's in our product development, we focus on the actual needs of the patient. So we have a patient-centered design approach, which we told we had as well before this program. However, throughout this program, we had the chance to gather very detailed, honest, and transparent feedback from the patients, which helped us understand a lot. Previously, our main interaction with the patients to gather feedback was our health professionals. So getting feedback through our health professionals who are also not tech savvies was filtering a lot of very important details from us. But throughout this process with these detailed feedbacks, detailed videos directly seeing patients, how they're interacting with the application itself, gave us a lot of valuable inputs. I believe we worked very good with Humani. This is from my point of view. I hope you also have the same opinion. I was very impressed that because as a startup, we have to be very fast and we have to move agile and bring change in a very fast manner. And I was very happy that you could also go along with it. So we actually had a very critical point during this program. We saw in the initial 2 weeks that the AI trainer, it was not very easy for the patients to adapt to it and use it. And we received some harsh feedback as well, seeing the patients talking directly about their experiences. We sat down as a team, really a couple of days, thinking about how we can solve this. And we had one of the quickest iterations at Breathment's history, and they changed really the rest of the program for us, and I believe also for the patients. So we also integrated this change along with this program. This was very beneficial. And last but not least, we gained real-world insights, very, very valuable insights from actual COPD patients. And we are a German-based company, so we didn't have a lot of information about the system and about the patient needs here in the UK. So it also brought us very, very good insights about how the healthcare system focusing on these conditions work in the UK. So we received a lot of harsh feedback on our actual solution, and we found that this was the most creative one, which we loved internally. So one patient said it was like constantly having one of those passport photos taken in one of those booths. Get your head here, get your head there. It's not how I want to spend my evening. And he was absolutely right. When we thought about it, like our AI trainer, so it's detecting the patients in real time, their positioning, and they give instructions to the patients on how they should fit themselves to be in the proper positioning. And when we read this, it's such an honest and transparent feedback that we receive on our actual solution. But other than this, we also received very, very, very beautiful feedbacks on our solution. And one of them is this one. So one patient said, this app is just so good for me, it's make my breathing better, make my stress level better. So I'm so grateful and I'm so happy to be involved in this project. I'm so grateful for the people who chose me and then give me the opportunity and introduce me to this app. So this specific feedback just ensured us why we as the founding team started Breathment, and it's made us really feel like we are doing something for the good of these people, something that would help these people. So long story short, we got an amazing time. Mainly, I'll repeat myself, but this program was super important for us to have, to understand the actual needs of the patients and to further develop our solution based on the needs of these patients. We gathered very, very cool feedback also on the reports, like what Karen from BreathTec said. We had a lot of not only feedback on what is good, what is bad, but also a report on what could be improved as a solution for these problems or as enhancements to our software. We also already started working on them in a short time. And as Breathment, I would like to maybe conclude my conversation. We are on a mission to enable everyone all around the world to take one free deep breath without the need of any additional personal or tools. And we don't see this event here as a farewell, but we also are very much looking forward to work together with Asthma Lung UK to bring our solution into those who are in need of these diseases. And once again, thank you very much for the entire opportunity. Thank you for the Asthma Lung UK and for Humanly for the collaboration. And we'll be very happy to stay in touch and work forward.